Hi, I'm Dr. Angela Yakey.
And I'm Dr. Kathleen O'Neill-Smith.
Welcome back to the FIRRIMup Doctors, Good Medicine docu-series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Hello,
Thank you,
everyone.
Emily.
Welcome back to the FIRRIMup Doctors webinar. So happy to have you all back today. Now I'm going to introduce your FIRRIMup Doctors, Dr. Angela Yakey and Dr. Kathleen O'Neill-Smith.
Woohoo!
Thank you for coming, everybody. It's Tropical Storm ETA or ETA or whatever you want to say down here in Florida, Dr. Kathleen. So we've been having some tech challenges all day, but we have overcome. Thank you, Emily.
Well, I hope we don't have any today, but if we do, we'll be back.
Yeah. And thanks everyone for being patient. We're continuing on with this month's theme on fascia. Today specifically, we're going to be talking about movement, fascia, and Marlene's going to get on soon, we hope, and talk about Qigong in particular. So here we are. Last week, I talked about a case of fascia and myofascial pain. Today, we're talking more on soft tissue, specifically movement. And next week, we have a special treat on regenerative medicine. We're going to talk about platelet-rich plasma in the context of hair restoration. So fun.
Yeah, I think it's really important because fascia is skin, right? It's the internal skin, and it's one of the more important skin. And typically, we think of skin as our largest organ, but fascia is enormously bigger. So it's really important to understand fascia, never underestimate the importance of fascia, and to begin to explore all of the nuances of fascia, everything it responds to, positively, negatively, and how do we change those things. So I think that what Marlene, I've seen her talks before, and I've done her work, and she is exceptional for our internal skin.
Yeah, so I like that, the internal skin. So the interventions that we're talking about today, at least in terms of supplementation, include collagen and vitamin C, phosphatidylcholine, good nutrition. That actually does affect not only your skin, your hair, your nails, but your fascia. And fascia is so important. We believe that fascial health or soft tissue health equals overall well-being and health. And Marlene will be joining us shortly as our guest, but she said I could be free to tell you all she's 70 years young and she acts like she's more like 30 or 40.
Wow, look at that picture. That is called good fascia that allows for good skin. But, you know, somebody just asked a question about, and said that somebody had recently told them that skin was the largest organ. And that is for the simple-minded, but not for you all that are listening here today, because really, you know, skin, the outer surface of skin is, you know, we're shedding constantly. But the inner surface skin, which is the fascia, is so rich. It is so rich. And I don't know if you've seen the little video that Dr. Akey often shows about, what is it, traveling under the skin? Or
it's called Strolling Under the Skin by a French doctor, Dr. Claude Jean-Berthaud, who is an orthopedic surgeon who was the first to do live endoscopy as he's doing hand surgery and orthopedic surgery to visualize live fascial tissue in 3 dimensions. Yeah, I don't know that I showed this crowd that.
We have to do that. And next week, maybe even before our little PRP and regenerative case, let's show them that, because that is just phenomenal. And you'll see all of the life. It's like being under the ocean and seeing all the life under the ocean, from the smallest algae to the largest fish. And that's what you see with the fascia.
It's kind of like scuba diving, right? That, you know, it's just within the past decade that we are even able to visualize it, because like people like you and I, when we studied anatomy and histology, there she is, we actually saw it in formaldehyde. We saw it cut in sections, but now we're actually able to see it live. So I'll tease you all, but if you want to see it before next week, again, it's on YouTube, Strolling Under the Skin.
Woohoo.
So Marlene's joined us. Marlene is a nurse and used to be an operating room nurse, a licensed massage therapist, fascial expert, Chinese medicine doctor, acupuncture physician, and exercise physiologist. And
Woo.
she is part of our awesome team at North Florida Integrative Medicine. She's been an adjunct instructor of acupuncture and Qigong at the Osher Center for Integrative Medicine at University of Miami Miller School of Medicine since 1999. And she knows fascia. So her passion is Qigong's flowing movement patterning. She knows craniosacral. She knows how to release areas that are tight, to give strength, comfort, resilience, to increase health, energy, mobility, and vitality. And Marlene, I bragged that you're 70 years young, but you act more like 30 or 40.
I feel it.
Yeah, so what we're going to do is just go through some basic concepts, and then you could show us some movement or even talk. Feel free to talk. This is her treatment room in the building next door to North Florida Integrative Medicine in Gainesville, Dr. Kathleen.
I've seen it. It's gorgeous.
Yeah, next slide.
And she is too.
So remember what I mentioned last week is that man, or Geppetto, Joseph in English, is the puppeteer who made Pinocchio on your left. He can only imagine two dimensions, like how we were taught anatomy, insertions, and origins and insertions. And so that's why Pinocchio, who wasn't alive, was walking and moving like a puppet. However, due to fascia and the multiple dimensions of force, when Pinocchio became a live boy, he's able to move like us in multiple dimensions. And now he's dancing.
Hyperactivity. There we go.
Next slide. So remember, the fascia is a cat suit, not only externally as in this picture, but internally around every organ, every tissue, every myofibril. Next slide. It's really important that we remember that, for example, this marbled meat, the fascia is the white collagen, elastin proteins on top, but within there, as we'll show you next week in 3 dimensions, is fluid. And it's really important to keep not only the proteins healthy, but to make sure we're well hydrated and move. Next slide. Because movement actually helps the fluid to move so that we have no stagnation or chi stagnation, which Marlene, do you want to just mention chi stagnation before I move on? It's a Chinese medicine concept.
The chi stagnation comes originally from frustration, and we all get frustration. Tightens up our fascia, and lack of movement. It's like when you have a lake that has stagnant water and all the silt settles in the bottom, you get that sludge, and then you don't feel clear-minded, you feel sluggish. That is stagnation.
I think one of the things you said, Marlene, that's so important is that it can even come from frustration, right? So stress, and we can talk about stress later, but I think that the reality is stress will produce many changes in what's flowing through the fascia. Remember, we said it's like that water with lots of life in it. And if you change the dynamics of what's flowing through there, the fascia will tighten. And obviously we tighten and we stiffen, and you can feel it in your neck and in your jaw and things like that. But it's really important to understand that just stress alone and even over exercise can tighten you so much. So I think that Marlene is so good and so facile with talking about the fascia and, bringing us through stretching in Qigong and the energy and the vitality that we can gain by doing Qigong and stretching exercises. You can get energy. They are a type of movement, and she's going to talk more about that to you, but thank you.
Yeah, so it's important to move and keep the chi, or the energy, as well as the fluid located within the fascia in your body moving so that you don't have a blockage in your energy and flow. Next slide. This is a picture that was made by Dr. Helene Langervan. She presented it at the NIH Heal Myofascial Pain Workshop that Dr. O'Neill Smith and I attended in mid-September. But the point here is that this very thick soft tissue or fascia in the thoracolumbar area has many, many layers. And we want to make sure that every day we're moving in all of those directions. There's at least 5 directions. And in conventional Western exercise, we're moving front to back and side to side. However, in Chinese medicine, as Marlene will demonstrate shortly, is that they're moving in circles and they're moving in multiple directions. And that's so important to keep the fluid going and to keep us thoracolumbar fascia facile.
Well, think about that. Back pain is like one of the number 1 complaints in medicine. How many people have back pain at some point in their life? But if you look at Marlene and you see this beautiful young woman, you basically know that she's been taking care of her fascia. And I just so applaud you, because we learn so many old-fashioned, themes. And I think that you have an expansive mind and obviously expansive fascia.
Yeah, and I would say that keeping this picture in mind for any naysayers to what you're going to try to explain at the dinner table, you could just show them the picture or share this talk with them, because it's very black and white to me that you do have to move in multiple directions in order to stay young and limber. Next slide. When this doesn't happen or you have injury, instead of being able to glide, and Marlene will show us how she glides, but glide as in picture A, where you're gliding and you don't have any pain. If you've had a whiplash injury or a back injury, or you have chi stagnation, or the fluid's not moving, you could end up as picture B, where you don't glide between those layers of soft tissue and there's an area of lightening or pain. Because remember what I taught you last week, that 80% of the peripheral nervous system, the little tiny nerves, are located within the soft tissue or fascia. And that's why it's so important to keep that fascial tissue healthy.
I hope I'm not being repetitive, but if you look here, you could think of these as those 2 maybe pieces of glass that are going to slide on top of each other, 2 vertebrae or 2 pieces of fascia that are in between. We have, if we think of our vertebra, we have our discs, right? And everybody talks about their discs in their back being dislocated or herniated or things like that. So that would be in between those 2, plates there, those 2 plates of fascia, so to speak. But if you lose the fluid, if between the 2 plates, if the 2 plates become too thick, the gliding doesn't happen that much. And that's why Dr. Akey is reminding us that we need to move in multiple planes in many directions, twisting, bending, turning, and all of those things. And Marlene will show us.
Yeah, so now I thought it's better, it's show me, don't tell me, right, Dr. Kathleen? I think you guys have enough room to move a little bit. Marlene has agreed to do a 5-minute experiential, so you really understand the multiple dimensions of movement. So I'm going to turn my video off and actually do it with you. And then when Marlene's done, I'll come back on and we'll do some talking and Q&A.
Okay, we're going to move. So my favorite movement is Qigong practice because it moves all the water in your body. And we are 75% thereabout water. And then we have all the mitochondria that are waiting to get activated. So we're going to do that now. In 5 minutes time, you're going to feel energized. So stand up and breathe in and bring your arms up, knees bent slightly. And then as you breathe out, you're going to squeeze your hands, your knees, your toes, your face, scrunch everything in the letter C, curved forward, exhaling. Tightening your abdomen, your core, pulling up your pelvic floor. And then the breath comes in naturally. That is yang phase, opening, breathing. All forces in nature are yin and yang, opposing each other and yet intermingling with each other. And so we are intermingling yin and yang. We're squeezing yin now, squeezing yin. Squeeze the muscles, squeezing, rolling forward. We are making the spine flexible by rolling forward gently, only 60 to 70% effort. And then we breathe in and we open. The breath guides the pace. And the reason the pace is slow is so that all the tight fascia can catch up with the gliding. We give it time and we give it space. Squeezing out, rolling. Opening up, breathing. This is a first move. When you stand up out of bed in the morning, you can do this. And then squeezing out again, breathing out. And when we breathe in, when we breathe down, diaphragmatic breathing into the belly, we're activating our neurotransmitters. And so we're doing a lot of things all at once, so it's very efficient, time efficient. Squeezing out, breathing in, and then coming back to soft, ready position. The feet are rooted, hip distance apart. Knees are slightly bent, your pelvic floor is drawn up, your navel is drawn toward your spine. Good, now we're gonna fluff up the disc pillows. Dr. Akey, I know you love that. So we're gonna reach with fingertips, let the neck slide over to the side, just allowing no pressure. Reaching the fingertips, sending roots down in this side. We get that dynamic of Qigong, where we're rooted and reaching and breathing. And we're fluffing up our disc pillows. On the exhale, we come back, soft, 70% effort, breathing in, allowing time with the breath to come in deeply, opening the diaphragm, all those neurotransmitters changing. We have the dynamic of rooting and reaching. And that is liver energy, that is springtime energy, opening side body, rooting and reaching. That's liver, that's wood, that's tree growth. That's generative energy. And coming back, fluffing up our disc pillows with rooting and reaching. Breathing in. Coming back, we're going to do one more of each side so the side body has a chance to do that. So that fluffing creates space between your vertebrae and then allowing it to come down gently with less gravity. Breathing in, coming back, and now we're gonna stand a little wider, sending roots down into the feet. This is horse stance, as in Qigong, Tai Chi. Okay, from here, we're gonna do the same thing. We're gonna reach, send the roots down, rooting and reaching. Just let your elbow fall on your thigh. Opening, breathing, breathing, breathing into the side ribs. Coming back, breathing out. Good, and other side, breathing and reaching and rooting. And coming back. One more on each side. Just keep going. Breathing in. Coming back. Okay. So now we want to do the spiraling muscles, spiral fascia. So just bounce a little bit here. Breathing deep. Good. Now we're going to do swinging gait. Just let your arms fall where they may as you swing this gait. Looking with your eyes around, all around you in all directions. Breathing deep. And swinging the gait, feet are rooted. Letting all of the spiraling of the tiniest, deepest muscles and fascia inside your spine, they get vitalized with blood flow, body fluids, all of that wonderful nutrient matrix that they need to be vibrant, resilient, and alive. I can tell you that I did in my past, way back, I had a couple of whiplash injuries that kept me immobile for 2 years. But lo and behold, injuries become blessings. We learn from them. We learn new ways to move and become alive. Okay, slowly coming back. Now we're going to close our chi, bringing the breath in. Gently bringing your hands in front, breathing out. Knees are slightly bent, perineum's drawn up, top of the head reaches up to the heavens. We breathe in. We're consolidating the chi to come and be inside, regulated and calm. Good, breathing in. So you'll feel calm, but yet you're going to feel so alive. One more. Closure. Breathing in, coming close, and put the right hand on the lower belly, left hand over top, and that's where our energy gets consolidated at the seat of gravity. And take inventory for a moment. Feel how centered, how balanced you are from the roots up to the top of the head. And if at this time on your own, if you feel any places in the body that are starting to talk to you and say, oh, but can you open this and can you open that? Just be very gentle, go slow, honor the physician within you that's telling you to give it a little opening. Thank you so much.
You are amazing. Thank you. Absolutely amazing. Marlene, what benefits have you found? We're still on, right? Can you hear me?
Yes, I can hear you.
So how long have you been practicing Qigong?
Since 1990.
Wow. So for
Yeah.
30 years.
It was my window that gave me safe movement and restoring flexibility.
That's what I love. Yeah. It's movement. So Qigong is movement, and it's a really good energizing.
Remember the breath, movement and breath, movement and breath.
Beautiful. Fantastic.
I think we're off.
Yeah, so it's thank you. That was a really great break. I know Dr. Kathleen and I have been doing telehealth all day, so I needed to open up my disc pillows and my spiral lines. And, you know, it's really amazing how we could shift in 7 minutes. Literally, that was a 7-minute exercise you shared with us. And, you know, you had said something about what all of us try to obtain, which is relaxed attention. I mean, that's what you try to get with ADD, drugs, with exercise, etc. But I agree that Qigong is a sure and steady way to get there and not only move the fluid and the fascia.
It's so time efficient. It is so time efficient. You get a lot out of it in a short period of time. It's like, it's a gift from the East. It really is.
I love that. Yeah, I call it no exercise, you know, and an energizing exercise, because if you feel sluggish and you do 5 minutes, it wakes you up. You get flow in your brain.
It can be utilized by sports medicine as well, because you warm up. You warm up and prepare, then you feel balanced and alert, and you're going to have less injuries because you're more aware of how you feel.
Fantastic.
Well, it's no surprise that you were picked to lead us doctors at Integrative Health Symposium in New York City, where Dr. Kathleen and I presented on fascia in February of this year, and they invited you back to do the same. So we are so blessed to have you as part of our team here locally in North Florida Integrative Medicine, but also helping us out with the FIRRIMup doctors. So thank you so much, Marlene.
Thank you.
You're welcome. Thank you.
Masuma wants to know how often she should do this 7 minutes of Qigong exercise that you just shared.
Oh, I would say 3 times a day. 7 minutes, 3 times a day is 21 minutes. How wonderful. What a gift.
Yes, Anna wants to know about classes. Yes, we're being careful. We're being very COVID conscious. So if you're part of North Florida Integrative Medicine, we are offering group medical visits. The next set will be December 3rd and 17th. So you could just email in, Anna, if you would like to be a part of that. But you can certainly go back to this YouTube. This will be published on YouTube, and keep doing your 7 minutes 3 times a day.
Thank you. What a gift. YouTube.
Yay.
Marlene, do you have any other suggestions in terms of movement, fluid, fascia flow? Because we want to be like you. I turned 50 this year, as you all know, and she's 20 years my senior. So I always say, I want to be like Marlene when I grow up.
It'll be kind of expansive. The more you do it, the more you want to do it. You know, because if you feel any ache or pain, it gives you the vehicle to go there, to do the basics, And then you'll be guided from within on your feeling sense as you develop the feeling sense from the movements and how you're feeling, and how when you do the basic spinal openings with safety, then you can expand it beyond that, because after a Qigong 40-minute practice, there's a period of time where we do in the major class, after the traditional moves, then we go into free form Qigong, which allows personal customized movement and breathing. And it is phenomenal. That's where you become the master of you.
And that's what you mean when you say, listen to the inner physician, because your body will tell you where it wants to move.
You know, and we can take that all the way to the embryonic stem cells. We can take it all the way to muscle memory, to fascia memory. We take it all the way there into the Western cellular physiology, and then we begin to understand this repatterning, the repatterning that just creates the renewal.
Mhm.
It's unlimited. Let me tell you, you see me, it's unlimited. It's amazing.
Yeah, that was news to me that you had 2 whiplash injuries and you were disabled for 2 years. I didn't know that. Yet I've known you.
A lot of pain, and those Chinese masters helped me. This is why I share.
Wow.
Wow. And don't forget that Qigong you taught me, is the mother of Tai Chi. Qigong you could do from age 7 to 107, right? That's what you said. And also Pilates came from Qigong.
Take any, Dr. Aki, I always tell my students, do not take a Tai Chi class unless the teacher gives you Qigong warm-ups to begin with.
That's really good advice.
Yes, it is.
Yeah. Mm-hmm.
Yeah, moving in all the dimensions as we just did is really important for athletes. I know one of my sons is a D1 athlete, and you have an increased likelihood of injury if you're not moving in all the dimensions. So don't forget the 70% effort with Qigong. Don't forget to move in all these directions. And now you have a tool on YouTube. Thank you so much for coming, Marlene. We really appreciate your time.
No, thank you so much.
Thank you. And they can have private sessions with me.
Yes, just email into FIRRIMupDoctors.com and we will connect you with Marlene. Absolutely.
Absolutely.
There's medical Qigong, which includes movement and the practitioner's hands-on facilitating the opening of the fascia at the attachments.
Mm-hmm.
Yes, and also you're quite facile at acupuncture. So that's a talk. We'll bring you back to talk about acupuncture, but just to whet your appetite, everybody, the fascia tomes, which are the dissections of the fascia that we published in our book, Fascia Function and Medical Applications, it overlaps with acupuncture meridians, like in her picture in the back, by 80%. And so I don't know how Chinese medicine doctors figured this out 5,000 years ago. But these are energy channels that are wormholes into your autonomic or automatic nervous system. And so, Marlene, you're just going to have to come back. We so appreciate your time today, though.
You could have her back once a month. She's so knowledgeable and inspiring.
Thank you for coming, Marlene. I wanted to let our crowd know about an exciting offer that Dr. Kathleen and I spent a couple of weeks developing. And it's next slide, Emily. It's really exciting. It's the POW Masterclass, the Pursuing Optimal Wellness Masterclass. We're now enrolling. It's a 12-week program that starts at the end of January. And I just wanted to remind you all that Dr. Kathleen is a former Olympian and coach of the USA national rowing team. She was also the former medical director at Tom Brady's place in Boston, TB12. So we are so blessed to have her literally coaching us to wellness. And so we have an informational session this Tuesday, November 17th. At 4:30 to 5 o'clock p.m. If you're interested in finding out more about this exclusive program that begins at the end of January, please email at FIRRIMUPDoctors@gmail.com. We already have a list of almost a dozen people, and we only have room for 12 for this round in January. So please mark your calendars and email us if you would like the Zoom link to come to the informational session this Tuesday, November 17th on Zoom, because we want to fire you up to take control of your health so that you are in control of your health, especially in the middle of this COVID-19 pandemic.
I am really excited for this class. I really think it's going to be great. We're going to talk about all of the foundations. We're going to start a whole new foundation, lay the groundwork, start the foundation, and begin to build, really educating you on the different ways that your body works. Again, I've taught ninth grade biology, so hopefully we have an ability to make it user-friendly for everybody at any level and really give you a support group, but also mostly educate you so that you can figure out what your intentions can be and where you might like to start within a group setting to be the strongest that you can be today and in the future.
Next slide. So I'm looking at the chat. I don't see any other questions. Jennifer wants to know when Emily will be posting this on YouTube. I think Jennifer wants to start practicing. That's great. Thank you guys for coming. So YouTube usually gets posted like within 24 hours. And as you heard from Marlene, you could do 7 minutes 3 times a day. It's a great break if you're doing, especially if you're doing a lot of video conferencing.
Yeah, I'm going to be doing that 7 minutes 3 times a day. Fantastic. I've been doing it. We've done it. Yeah. It's wonderful.
Jennifer says me too. Okay, so since there's no further questions, we look forward to seeing you next week. We're going to be talking about platelet-rich plasma regeneration and continuing on the theme of fascia. We'll show you the video Strolling Under the Skin by Dr. Claude Jumberteau at the beginning of next week's FIRRIMup Doctors webinar. Thank you, and Emily, we'll have you take it away from here. Thanks, Dr. Kathleen.
Thank you, guys. Good to see you. Be safe in that hurricane or the rains or whatever's going on down there.
Absolutely.
Look forward to seeing you soon.
So everybody be safe, be well, and God bless you all. Bye-bye.
Bye-bye.
Thank you, ladies. Yes, Jennifer, I will be posting this video as soon as it finishes up today, right onto Facebook and then also to YouTube as well. Now, for those of you that want to stay on, I have some great deals to offer. So our first one is going to be the same as last week. We have the vitamin C and the collagen. Both of these are just wonderful to have in your daily, supplement kind of morning routine. The vitamin C is always good. And then collagen is really well for improving, skin, nails, joints, your tendons. It kind of just gives you that boost in the morning. And for those people who don't like to eat chicken broth or maybe fish, this is the perfect way to add this into your daily routine. And so the vitamin C code for the 10% off is going to be FIRRIMup VITC, VITC. And the code for the collagen is going to be FIRRIMup Collagen, COLLAGEN. Next, we have the phosphatidylcholine, which is great for, your brain and your nerves. Again, this is all just great to have with you and to take daily. So this code for 10% off is going to be FIRRIMup Body Bio, BODYBIO. And again, this is all on our Get Healthy store, which you can find through our FIRRIMup Doctors website. Next, we have the Omega, which we've shown multiple times. Omega is just a great supplement to have. It's great to include every day. And for those who are vegan, we have a special vegan Omega that you can take. So for the regular Omega, the 10% off code will be FIRRIMup Omega, OMEGA. And then for the vegans, we have a special algae Omega, and that code is going to be FIRRIMup Algae, ALGAE. Again, 10% off if you use either of those codes. And then finally, we have the hormone fix. We have for both men and women. Hormones are just always something that you want to kind of keep in line because hormones out of whack is not going to be good for anyone. So if you would like either of these for men or women, it's going to be the same code, which is going to be FIRRIMup Hormones, and that is HORMONES. Again, all of these codes will get you 10% off all the following supplements that I just talked about on our Get Healthy store. And these are all good through the last day of November, November 30th. And then speaking of hormones, we have Dr. Aki's Fine Tune Your Hormone Symphony, wonderful guide to learning your hormones and understanding how they all work. So if you would like to purchase this book, it is available on our website, FIRRIMUPDoctors.com, as well as on Amazon. And then we have our Kick COVID-19 to the Curb. With the COVID cases rising again, this is always a great book just to have kind of handy whenever needed, whether it's paperback or a ebook, just to follow through with how to kind of get through COVID if you're feeling some symptoms, or great to share with friends if they are going through it as well. So our Kick COVID-19 to the Curb is available on our website, FIRRIMupDoctors.com. You can also call the office for paperback, or you can go on to Amazon Kindle, Google Play, or Barnes & Noble to buy the ebook version, which is $9.99. The paperback is $29.99. And if you purchase either of these books, you can go ahead and take 20% off of vitamin C and zinc AG. Now, this is a different vitamin C than the first one I showed, just to make sure everyone knows these are going to be vitamin C pills, or the capsules. So again, if you purchase either of this book in either form, as long as you show us proof of purchase, we will go ahead and honor that 20% off discount for you. And lastly, Dr. Akey and Dr. Kathleen's Fascia Function and Medical Applications textbook that they were helped to write. Again, we have a few paperback copies available at our NFIM office for $55. This can be curbside pickup. All you have to do is give us an email to nfimgmv, as in Gators Make Victory, @gmail.com. We also have it available on our website, FIRRIMupDoctors.com and Amazon.com. As I've mentioned before, you can go ahead and take 20% off until the very last day of the year, December 31st, using the code SCI20. But again, that code is not able to be used on Amazon. They will not honor it. So if you would like to get 20% off, go through our website or give us an email. And that is all that I have for you folks today. Thank you again so much for joining us each week. We really, really just enjoy having all of you guys on and learning something new each week. So next week we'll be back with some PRP and some more on skin. And that is all I have for you today. So have a great weekend.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupDoctors.com. That's FIRRIM updoctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare professional.